Hello and welcome back to another episode of the EP Growth Podcast. I'm your host, Ryan McCarthy, the Director at Hunter Rehab and Health, and I'm joined by a special guest on today's episode, Paul Nixon, Qualified Prosthesist and Manager at APC Prosthetics. How are you, Paul?
I'm doing well, thank you. Thanks for having me.
Not a problem at all. Very excited to have you on today's episode. I met you probably about a month ago now. You had an open night at APC Prosthetics, and a very informative open night it was. It wasn't just your boring slideshows. It was actually an interactive information night where we got to actually go behind the scenes and see exactly how prosthetics are made. So I had so many questions from that night. It was a great night, and I thought I would get you on the podcast to help answer the questions for the exercise physiology and allied health community out there. So here we are today.
Yeah, fantastic. Yeah, it was a good night, wasn't it? It was really nice. We had users and end users, allied health colleagues, and even some of the support workers and family along, which was, it was a great night.
Yeah, a great idea. So first of all, let's just start from the very beginning. Tell us a little bit about your background and how you got started and why you chose a degree in prosthetics and orthotics.
Yeah, so it's an interesting one. I have a father who is a who is a carpenter. So I was always interested in building and making things. Oh, sorry, I should say he started as a carpenter, then he was a builder. But then I always also had a bit of a health interest. So loved biology at school, and I was interested in potentially getting into a career in physio, that sort of area. And so I remember in year 12, I'd also at the time been reading about, oddly enough, probably for someone of that age, reading about the stuff that had gone on in Cambodia under the Khmer Rouge, the Pol Pot regime. So, landmine victims and things like this. Books like First They Killed My Father, which is basically a fascinating first-hand account of someone growing up in that area at the time. And so I'd sort of had interest in that humanitarian side of health and things. So when my sister said, "Oh, I've met this person that did prosthetics, and it looks like you get to, use machines and build things as well as do health," I was like, that sounds like something for me. And so I just kind of honestly just basically read the blurb of the the course and went, yeah, that sounds good. Let's apply for that. Partly because I wasn't sure whether I had the grades to get into physio at the time. It was a bit competitive.
Yeah.
And then there we went, and that was the start of that's a bachelor degree at the time, which was started it in 2004.
Yeah, great. And was that at La Trobe?
Yeah. So La Trobe in Bundoora, which is a little suburb in Melbourne.
Yeah, excellent. And is there many universities that offer that degree over Australia?
Yeah, so at the time it was the only, and it was just fortuitous that I was from Melbourne, so it sort of made life easy for me. But at the time it was the only degree Australia-wide. Since then, and you're going to challenge me for dates here, but probably in about the last 5 or 6 years, there's been a second degree open up on the Sunshine Coast at the USC, University of Sunshine Coast.
Yeah. Okay.
They're both now doing. I think they changed the name and the type of the degree multiple times. It seems for me, but I think currently it's a Masters of Allied Health generally that they do, with a sort of a specialization in prosthetics and orthotics.
Yeah, excellent. And I'll be honest, I had no idea the degree existed until after I graduated from uni. I hadn't even heard of it, to be honest. So what subjects do you actually study at uni in terms of the blend between health and engineering machinery?
Yeah. So at least, as I say, I'll comment on what I did, which was plus years ago now. But so largely it's similar. So we did effectively a common first year with other allied health. So there was podiatry, physio, nursing, those kinds. And we did, very standard anatomy, research methods type subjects that you do in first year, and cleared that out of the way, I guess. And then they would then progress on to be, we would do more prosthetic specific anatomy. as the course went on. But then additionally, we did some, as you said, some engineering subjects. So materials, learn about materials and the physics behind those, along with a whole lot of practical tutes where we would go up and actually make things. So first year we made a training arm for ourselves where effectively made a fist and cast that for someone, and then we made an arm for ourselves. And so you started to learn the sort of, I guess the trade side of it, for want of a better term. And then those turned into more clinical based subjects where you're working with actual patients throughout the degree. But they sort of structured it that you would do, start with the kind of, I guess, simpler orthotics and prosthetics. And then, we'd started with below knee prosthetics and below knee, I guess, orthotics, ankle foot orthotics and things like that. And then progressed, as the degree went on, to higher levels of amputation, higher levels of, orthotic care.
Yeah.
We would do clinical placements as well. So the actual final year of the degree for me was literally 6 months of clinical placements, two large block 8-week placements, and then exams to finish off. So
yeah, great. Yeah, I'm a big fan of the large placement blocks. That's where you do all the learning, isn't it? I think universities should have more practical, more placements in them to get people more prepared. So
yeah, absolutely. And I know the Sunshine Coast, they do that throughout the degree as well, which is really, really good to hear.
Yeah, excellent. So then just give us a rundown of your new grad year, and then into how you got to APC and into manager there.
Yeah, so I, as I said, I graduated in 2007, and I went straight. Lucky enough, it was an odd degree because it finished halfway through the year, and I was lucky enough to pick up a job. Oddly enough, I did 3 months replacing a guy on long service leave in Newcastle, and so a guy of I don't understand how they did this, but they there's a guy with 20 years experience, and they thought, oh, let's get a new grad to replace him. So that was a bit of a baptism of fire, but in some ways really good, because I was thrown in the deep end and had a little bit of support, but so in some ways that was probably the negative aspect, but certainly a lot of thinking on my feet and making it work. So after that 3 months, that finished up. The guy obviously came back, and I went back down to that was in Newcastle, and I went back down to Melbourne, partly because I was going to get married, and then worked for a year at a private orthotics company. So doing a lot of things like making foot orthotics, shoe inserts, I guess, if for people that don't know, and then AFOs, ankle foot orthosis splints, things like that, and as well as doing things post-op like fitting knee braces and cam walkers and things like that, which is, as I've said, not really why I envisaged getting into the degree, but it was good experience working with clients and being able to develop rapport and the skills you need as a new grad. I then probably got itchy feet toward the end of that time, and I was looking for jobs, and luckily enough one came up in, again, with health, actually the same place I worked at straight out of uni. They were advertising a 12-month position, and I came up, and we moved up here soon after we got married, and worked there for a year doing prosthetics, largely interim prosthetics at the time, which is basically fitting the first prosthesis, but then progressing fairly quickly to all different kinds of prosthetic work there, which was really good. Again, same thing, not a lot of support at the place where I was at the time. So then after a year working there, I got the opportunity to come across to APC, which I've been for the last 15 years or so, and have loved it. Yeah, it was a great environment to come into, and definitely a lot more progressive than what I'd been experiencing, and a lot of opportunities for me. So it's been great.
Yeah, it sounds like a credit to APC. Loyalty is hard to come by in the workplace these days. So 15 years, they must be
Yeah,
doing something right. So
yeah.
that's great to hear. So give us a bit of an insight. I'm curious to know the percentage of makeup of clients that you see, I guess, from the amputee perspective. Like I've got no idea, would they be from motor vehicle accidents, workplace accidents, diabetes? Like what are some of the reasons, and what percentage breakdown do you
Yeah,
see?
yeah, yeah. So we see probably APC is a little bit skewed as far as, in terms of our clientele from what the broad amputation population would be. But I guess if you want to talk in general terms, a lot of what we see is vascular related issues, as a result of diabetes or heart disease, things like that. And so it's, I guess in some ways it's a large amount of older people that have got circulation problems, an ulcer then occurs and they can't get it healed, so they end up having an amputation. So we do see a large, like if you want to put a number on it, I'd say that might be sort of 60 to 70% of amputees. But again, with APC, we're probably seeing a higher percentage of, I guess, quote unquote, more active clients, younger people. We certainly see plenty, our fair share of older folks as well.
Yeah.
So then a lot of those are funded. A lot of the funding that we're in that population is, state-based funding, and with the NDIS, we're seeing a lot of that kind of clientele. But yeah, thrown in there is people. There's maybe sort of 20-30% of what we do is work with people who have had a workplace accident or a road accident, and that's then resulted in an amputation. And often, see a lot of people come off motorbikes or things, and they'll have an upper limb and a lower limb amputation, so they can be quite complex in their needs, and also in their desires, being young people. They're wanting to get back to a high level of function. So that can be it's quite nice working with, but very challenging as well, to manage those expectations and try and do the best we can.
Yeah, excellent. And just touch quickly on that. Like obviously as allied health, we understand CTP, work cover, and NDIS fairly well, but you mentioned that state-based funding model. What is that? And how can you explain that?
So the I think it was back in the 80s, I think whoever it was at the time, I think it was, no, actually probably, anyway, free limb scheme became a thing in Australia. So basically, whoever, I think it was Gough Whitlam at the time, he said everyone should get a free limb. That's just a thing we should do in Australia, which is great. And the way they did that was they set it up based on state-based schemes, is my understanding. And so what people may be familiar with the body Enable New South Wales. So they basically they fund in New South Wales anyhow. They fund a free prosthesis for people that require it. So how it interacts with, it used to be prior to NDIS, it used to be everyone would go, if there was no CTP, no insurance funding, they would go on to Enable, and they would be on that for life, and that was that. The NDIS has come in, obviously, and it's for people under 65. So basically, Enable now is for people who are over the age of 65 when they have their amputation. But even also, a little funny little tweak on that is that because it's seen as an acute service, it's kind of part of, I guess, a health bucket of funding. And so that usually everyone's first limb, regardless of what age they are, if it's not an insurance funding, is funded by Enable. So that first, what we call the interim prosthesis, is funded under that scheme.
Perfect. All right, that's great. Good understanding. No, and good on Gough Whitlam. That's a great incentive. Excellent. So one of the questions I've got, I guess you mentioned doing a fair bit of work in orthotics. When would we refer to you as opposed to a podiatrist for orthotics? Can you give us a bit of, I know there'd be a bit of crossover, but it's the best way we could explain it.
There certainly is. There certainly is. It's different state to state too, I find, which is really interesting. So in Victoria, where I was from, orthotists did a lot of orthotics, whereas I find in New South Wales it does tend to be a bit more people think orthotics, they go podiatrist.
Mm.
In terms of foot orthotics specifically, they're in a lot of ways they're same. In terms of the way they're probably slightly different in the way we go about it, but in reality they're similar. I guess they're certainly in terms of as we get higher up in terms of, do we need to control the ankle? Do we we need to control the knee and the ankle? That's when I would suggest that an orthotist is really in their element.
Yeah.
But yeah, in terms of foot orthotics, it's a very similar thing, and in some respects it becomes about whether your confidence in the individual orthotist or podiatrist. If you've got a podiatrist that's doing a great job and they've had some great results with your clients, we'll stick with that.
Yeah.
Yeah.
Okay, great to know. And leading on to that, what allied health professionals do you regularly work with, and how does that relationship look like with or follow-ups with the participants or the clients and the allied health?
Yeah, so we work I do a lot of work with upper limb prosthetics in our facility, and so I work quite a lot with occupational therapists in that space. A little bit of work with physios and EPs for them, because they still do need to develop shoulder strength and function. But yeah, certainly in terms of training to use the prosthesis, we work a lot with OTs for that. In terms of lower limb prosthetics, we do work a lot with physios and OTs. Physios and EPs, and particularly in the clinics that we attend. Just to give everyone a bit of an update, we do traveling clinics where we travel to places like Tamworth and Port Macquarie and Taree. And we do clinics, and in those clinics, just the way they've been set up, there's usually a rehab specialist, an OT available, and a physio, and we work with them in terms of prescribing the limb, and then in the early stages, teaching them how to use it. And then more recently, and we discussed this the other night actually, Ryan, we've been really enjoying working with EPs and just having some really good results in terms of for people who are wanting to go to that next level in their function. So I guess in terms of how we interact, we're generally it's a nice little back and forth usually, because we can refer on to an EP or a physio, and then they'll and give an update of how we're seeing the person function, and then it goes the other way as well, which is really nice. So we have people feeding back, I'm seeing this aspect of the way their gait is there something we can do about that? Or this is happening at the ankle or the hip, I'm seeing these things happening, can we do something? And particularly for people that we develop a relationship with from a provider point of view, it works really, really well, because I know if you've been in this for a while, that I'll see things a certain way, another clinician will see certain things, and you're only going to do a better job if you can take feedback on board and use that to give a good result for the client.
Yeah, 100%. I think that works amazingly, that you're able to communicate back and forth, because, like I said, practitioner or the EP physio might have sort of those hardware-based questions or gait-related questions, and like you said, you might have those questions around how they're progressing functionally as well. Tell me a little bit more about the pathway that someone goes through at APC, like from when they first come in to see you, like how often follow-ups, is it the same for everyone? What does that look like? Are you seeing them not that often, so you're heavily relying on that allied health to take over, or that occupational therapist to do the majority of work? What does the pathway look like?
Yeah. So like early days, we're obviously seeing people a lot more acutely and regularly, and so that first 3 months, we'll usually fit I'd say about 6 weeks post, if we take that post amputation, we'll usually fit their first prosthesis, which we call the interim. Usually that's going to last sometime between 2 and 4 months, because of just natural limb volume change and shrinkage. And during that time, we're regularly seeing it to adjust and train and retrain and work with the physios. And there's quite a a tight little period there where we're getting that person up and going, and hopefully developing good habits from a gait perspective. So we're always really, a lot of that's done as inpatients in a hospital setting, in a rehab ward. And then once they're getting into the community, we're, spacing those out a little bit more. But I guess once someone, reaches, I guess, a more stable period at the sort of 6, 12, 18-month mark, whenever that is for them, it's a little bit different. We generally are seeing people every quarter if we can, at the most every 6 months, for people that are quite stable and can manage themselves pretty well. And often those appointments are primarily to work on the prosthesis and make sure it's still going to function well, doing things like swapping out components or lubricating certain joints and all these kinds of things. So as time goes by, we certainly do rely on those relationships with external providers more and more, because with things like EP and physio, you guys are generally seeing people at more regular intervals, and it's nice to be able to have that refer back point, because sometimes the last thing someone remembers to do is to call their prosthetist if they're having a problem. So that's always a nice thing.
Yeah, awesome. Excellent stuff. I think that's just about time for us, but is there any messages that
went so quick?
Very quickly, it always does, flies by. Is there any messages out there for EPs or allied health community that you'd like to get out to them?
Yeah, I think I really enjoy the relationships that we have with the people we work with, and I think, just as much as anything, I think I've already said it, but it's so important for us to be talking to each other and keeping each other in the loop, and we're trying to get better and better at that. We all get busy and things like that, but just whenever there's a question or anything, we just pick up the phone. I think we're quite willing to chat through things and receptive to feedback. So. I think that only just can result in a better outcome for the people we're working with.
Yeah, and APC's got clinics all New South Wales wide. There's plenty of other clinics apart from Newcastle.
Yeah, that's right. So we've got 2 clinics in Metro Sydney, one sort of towards the west out in Parramatta, Northmead Way, and then one sort of inner city, Alexandria. And then we've got a clinic on a branch on the Central Coast as well, and one at Hunter. But then from there we spread out. So as I say, we at Hunter branch in Newcastle, we do Tamworth, Taree, Port Macquarie, and then the other clinics do various prescribing clinics that are at different locations around their areas. So we've got a decent spread.
Awesome. And you mentioned as well, you do free discovery sessions for anyone wanting a second opinion or just inquiring about your services.
Yeah, certainly. So I think that's really important. We discussed that, Ryan and I, the other night as well, that it's so important for someone to be able to come and have a chat and not feel that pressure of, am I going to have to pay for X, Y, and Z. And it just can be a chance for us to give someone an idea of what we may be able to provide or work with them on, especially important for things like someone who's had an upper limb difference or an amputation. They tend to fall through the cracks, and it's not till later on that they go, is there actually something we can do to help me in this? So those are really, really nice. We can show and tell a little bit. We've got various levels of display components and things that we can show people, which is, I find, really powerful. So yeah, that's certainly something we offer.
Yeah, excellent. Great service there. And lastly, where can listeners find more about yourself or APC?
Yeah, so I'm on LinkedIn. APC is on Instagram and Facebook, of course. And then our website, apcprosthetics.com.au, is always a good reference. We've got a get in touch side of that, and you can actually link to different branches depending on where the client's located and wants to be seen. So
perfect.
Yeah, that's the best.
Excellent. I'll pop that all in the show notes for listeners out there, and follow those socials and check out the website as well. But once again, Paul, thank you very much for your time. That was very informative and very helpful.
Absolute pleasure. Yeah, thanks for having me.
No worries at all. All right, bye for now.
Okay, cheers.